In a recent nursing inquiry paper titled The Philosophy of Hans-Georg Gadamer, Lynn Corcoran and Karen Cook recognise but also attempt to cut the Gordian knot of complexity surrounding the use value of abstract philosophic ideas in nursing. They suggest Gadamer's famous book Truth and Method contains insights that potentially have concrete bearing or application in breast health clinic nursing. And so, Lynn, thank you for joining me. And please, can you outline the main argument of your paper? How might a focus on Gadamer's ideas inform nursing action in the real world?
Okay, well, thank you for reading my paper. And Martin, I'm just going to ask for you to kind of pull me back on track. Sometimes I get tangential in my answers. So if I need to get pulled back, you direct me. But I think the overarching idea in this paper is primarily in the title, and it is about the tangled or complex relationship between nursing philosophy and nursing practice. I think it's a bit fraught, and I think sort of the sub ideas in that paper involving Gadamer are around two major, maybe three major concepts. So what I've done in essence is, I mean, if you read Truth and Method, and I have a couple of times, it's dense. I went and pulled it just for this. I've got it here, and you can see like I have stickies, there's lots of writing, but on some of the pages, there's hardly any writing at all. So I think it's difficult to sort of kind of condense Gadamerian hermeneutics. It's probably more, what's the word, reasonable to pick a couple of concepts. And that's what we did in this article. So I think the first concept, prejudice, is a good one for nurses in practice. And I think the interesting thing about Gadamer's conception of prejudice is that it's not what we would normally link. It's not about bias, or it's not about racial prejudice. Rather, from a philosophical standpoint, it's about pre-understanding. So as nurses, we bring our pre-understandings to our practice. And the example that I give in the paper is I was working in a breast health clinic, and women would come in with unusual imaging and lumps and bumps and sort of pre-cancer and post-cancer treatment. And my prejudice or my pre-understanding was that a diagnosis of breast cancer is devastating to all women. And that was my initial understanding. That was my prejudice. But as I worked in the clinic and became more experienced and saw patients at the initial diagnosis, and then 1, 2, 3, 4, 5 years post-diagnosis, and then they were discharged, I realized that my pre-understanding was narrow. It wasn't really serving my practice or informing me because it was limiting. And what I learned from some women is they were very pragmatic with their diagnosis of breast cancer and their treatment. And breast cancer was just a thing that happened in the context of their health, and they got it treated and sort of went to their appointments, and then it was done. And so it wasn't this major life event. It wasn't sort of some of the narrative that we might read in popular culture about breast cancer survivorship, or like some women wanted nothing to do with that labeling. So my pre-understanding, my prejudice was limiting until it kind of opened up. And I think there's utility kind of in that idea related to Gadamer's philosophy. And then the other piece in the article, and two of other concepts of Gadamer, are conversation and language. And we can take conversation literally, as in conversing with patients. And I think I had an example of that in the article. And if you read any of other of Gadamer's, and I have them on the bookshelf, I'm looking sideways here, Gadamer really seemed to enjoy conversation. And it was this art or this act of listening with both your ears and like an openness in the listening. And we sort of might equate that with first semester, first year kind of communication skills. But I think Gadamer brought that conversation piece to the next level. about the topic being in the middle, and the conversation was like a vehicle for a bigger understanding or interpretation. So I think there's some utility in that. And then the other piece with conversation is Gadamer talks about conversation with text. And in terms of nursing and nursing students, I think of, certainly in our program, we get them to do reflective journaling. And so that's your text. And I think you're having an internal conversation or dialogue with your text, and in the service of understanding that clinical scenario or the topic. So I think there's some utility there for that concept of conversation, which kind of moves to the next topic, which is language. And Gadamer talks about the interpretation or the understanding being carried in language. So sort of back to that first semester, first year, we can be kind of really literal and talk about communication skills, or we can kind of really think about language and be careful with language. And I mean, one example would be just you and I in conversation now, even though I'm doing most of the talking. I could say to you, Martin, I assert that, or I argue that, whatever point it is. Or I could say, Martin, I gently suggest that Gadamer, ... Okay. So in choosing even that way that I want to say it, argue versus assert versus gently suggest, like choosing that language, that's how the interpretation is carried. So there's a certain carefulness with language. And I think that that's an important point in your nursing practice, knowing that even choosing certain words means you, is a funny way of saying it, but you unchose certain other words. So that's the language that you're using, and that's how the understanding is being carried between you and that patient in that language. So yeah, I don't know if I covered sort of the answer to that question, or you have anything else to.
I think you did, and it is a really interesting paper that is well worth reading. That was very interesting. Thank you. Let me just pick up on a little bit of what you've said. Whilst a subset of nurses take an interest in philosophy, and claims regarding the usefulness or the application of philosophic ideas to practice are made in many works, linkages between abstract thought and behaviour in the world can be difficult to substantiate. Now, your paper provides arguments where others often only assert. However, in your view, when nurses claim that a philosopher's ideas might be useful in or to nursing, for this claim to hold, how much should nurses know about the philosopher and his or her thinking? To reiterate, you do an excellent job with Gadamer. Nonetheless, Truth and Method is, as you've just demonstrated, a big book. Gadamer wrote a great deal, and his work doesn't stand alone or in isolation. Instead, it fits or has a place within traditions of questions and problems that were of concern to others when he wrote and that remain of interest today. So understanding his ideas might, depending upon what we think understanding involves, require significant engagement on the part of nurse researchers and readers. What then is feasible? I want to think that the answer is yes, but absent specialist education, can nurses comprehend philosophic thinking in enough detail or enough depth to allow them to make use of those ideas in a defendable manner? That is, assuming making use of is a justified ambition.
That's a big question, and I'll maybe break it down a little bit to attempt to answer it. I think, you asked, is it feasible? And it's interesting because I teach the courses that people don't like. So I teach philosophy, I teach research, I teach trends and issues. I teach the courses where everyone is like rolling their eyes and cringing. But my goal is to invite them to enjoy it just a little. And so I think it is feasible. And I think you know, what do they say? How do you eat an elephant? Like one bite at a time. And with philosophy, I think it's the same way. And I think that we just have to give it a bit of a try and be curious. And I think be open to making mistakes. I mean, one of the things that pulled me into Gadamer is this business of interpretation and keeping things in play and at play. So there's no right or wrong answer. And I just find that freeing. There's no right answer. There's no wrong answer. There's kind of an answer for now, and it might change. And to me, you know, obviously that doesn't work in a highly acute area, but I think that that type of thinking is important. And I think that level of abstraction is important, because I think it's about metacognition, or thinking about your thinking. So I think in terms of inviting students to think philosophically starts with being curious, not being invested in a certain position, even deliberately choosing the opposite of what you think to generate potential explanations for something, keeping ideas in play and at play, not being invested in a single point of view. I think like these are some very kind of pragmatic ways of thinking that can set the foundation for the possibility of understanding philosophy and philosophers, and potentially applying it to practice. And then you kind of level it, like, so that would be undergraduate. And then in graduate studies, if you've laid a bit of a foundation, then you start to introduce things like the word epistemology and ontology, and kind of breaking them down instead of being horrified by the word epistemology. When I teach master's students, they're just like, I don't even want to say that word. And I just say, think of it simply. It's about the nature of knowledge. Just think about that. Or ontology is situated in being. How are you in your practice? That's your ontology. So it's kind of demystifying some of the languaging and almost like scaffolding. So at the undergrad level, it would be being curious, generating questions, multiple viewpoints, multiple truths, not just one way of thinking. And then kind of scaffolding that in a master's level would be looking a little more closely at ontology and epistemology. And then I think when you get to the PhD level, I mean, the whole PH in the PhD is philosophy. So then you do dig into truth and method, and you look at Heidegger and Husserl and some of the other philosophers that kind of surrounded Gadamer, split off from Gadamer, taught Gadamer. You know, it gives you a more broad understanding. So is it feasible? Sure, it is, in steps and chunks and scaffolding.
Lynn, once again, thank you for joining me. Thank you for discussing your paper, and that was a very interesting. Links to Doctors Corcoran and Cook's work, along with the link to the paper, are provided in the notes. And of course, I recommend that everyone should read the paper. Lynn, once again, thank you very much. That was very interesting.
Thank you.